Now, in other news, the Limpopo Health Department is cancelling the contracts of over 150 community service doctors. A further 450 nurses and other affiliate workers will also lose their jobs. The province is terminating the contracts due to financial pressure. Limpopo Health MEC Popi Ramatuba says it's also looking at other ways to free up money.
It really doesn't make sense to let them go. That is why early this year we did made a submission, like we will always do, to Treasury to say we've got 146 community service doctors. That's not only bursary holders. Of course, if we were to focus on the bursary holders, we probably will be able to absorb them. But if we can't do that, because why should you divide these doctors? They are all your children. They are all South Africans. They all need employment. So we did made that submission. But Treasury says to us, you don't have money to can pay, because I'm saying to you, it's impossible for us to appoint without the approval from Treasury. So the question is, what are we currently doing to be able to do? We, as a department internally, we are looking at other ways on how can we free money, looking at our own self, so that when we go to Treasury, we should be able to say these are certain areas where we can. We're saying there are certain policies which were developed in this department. Today they might need to be reviewed. For instance, a policy on committed overtime, to say doctors in the past would be 4 in a hospital. Today they are 30 in a hospital. So do we still need to pay them that amount of group 3, which is, we are spending on overtime around 740 million. So why don't we, with our social partner, look into the matter of, we know those who are inside, because you know to trade between those who are inside, who are used to getting this particular salary, and those who are outside, to say, how do we then look at this particular category of doctors? Do we really need them to do that group 3 overtime, or they must do group 2?